Good morning, everyone, and welcome to our Tuesday, June 9th edition of the Women with Heart Online. Jess, you can change the slide there. So today's presentation is The Heart Truths About Health Behavior Change. Next slide, please. Our presenter today is Jessica Nooyen. You can see her on the screen there. She is the manager in research program development here. Next slide, please. So by the end of this session, you will be able to understand the functions of your role as your health manager, understand the consequences of inertia, and explore strategies on how to change for good. Next slide, please. So I am just going to quickly review our ground rules. You've probably all heard them before, but we're just going to do a quick review. So these sessions are for education only. Please connect with your healthcare provider if you need specific advice about your situation. We will answer questions generally, not personally. And we may not get to every question today, but we'll do our very best to answer them soon, and we'll post all of the answers online at that time.
Thank you so much for the introduction, Lise. Good morning, everyone. Thank you for, tuning in to today's or this morning's session on health behavior change, which is a very complex subject matter, but something that we all experience. Whether you've experienced a cardiac event, whether you're just looking to get healthy, change is an instrumental part of our day-to-day lives, and we're going to delve in a little deeper as to what that might mean for you, and possible strategies, as Lisa mentioned, to help you get on your way and achieving your best health life possible. So before we get to behavior change, the complexities around that, let's get right into self-management 101. So what do we mean by the management of the self relative to health behaviors? So we could break it down in three different pillars. So medical management, which is basically one's ability to understand the functions of their medication, understand what the prescription includes, how often they need to take their medication, and are compliant with their medical regime. It can also mean like attending your medical appointments, asking your primary care provider questions about your health needs, and having the confidence to do so. The second pillar, emotional management. So with the assumption that some of you on the call today or in the Zoom session today have experienced a drastic cardiac event, there are definitely emotional repercussions that come out of that. Emotional management is one, identifying how you handle your emotions relative to this new event, acknowledging the pains, the suffering that this new event has had on you, and identifying coping strategies to help you effectively manage these emotions so that you are productive in your health pursuits. By experiencing an adverse cardiac event or a recent diagnosis that has shooken you up a bit, it undoubtedly affects your role as well. And when we speak about role, it could be your role at home. Maybe you are the primary care provider. Sorry, not primary care provider, but maybe you're the primary provider of the household. And because of this new event, your role has changed in certain ways. You're not able to work as often. You're no longer able to do the independent daily activities that you once used to enjoy. And that takes a toll on you as well. So with role management, it's appreciating what the event was and coming up with tangible solutions on how to overcome that. And these are situations that require a lot of professional advice. And it's not necessarily that you need to figure this out on your own, but rather identifying individuals within your cardiac rehab network and the healthcare ecosystem to help you be the person that you need to be your best healthy self. And if you were to add all these three, if you were to add these three pillars up, you would know that 99% of your care is actually managed by you. So people can tell you what to do, people can advise you on how to proceed, but at the end of the day, you're the one who is dropping off your prescription at the pharmacy. You're the one who's picking up your medication. You're the one who's taking your medication. You're the one who decides what to eat. You're the one who decides how much activity you're going to do. You decide if you smoke or not. And those are all self-care paradigms that you need to be mindful of. So self-management, a huge piece to that is the literacy element. So we most often understand literacy in the context of education. When it comes to health literacy, again, it's being mindful of the choices that you make on a daily basis, the health choices that you make on a daily basis, and how that affects your overall health, your ability to live independently, your ability to pursue the daily activities that you enjoy doing. So just a few fun facts for you. So in Ontario, and I wasn't able to get a women's only stat for this, but for both men and women, Ontarians generally have a very low health literacy rate. So what that might translate to, in fact, approximately half of Ontarians have low health literacy rates. So beside here, you have a couple statistics. So for older adults with low health literacy rates, you are 2 times more likely to die within the next 5 years. Having low health literacy rates also means that you are generally not as compliant to your medication regime. You are not as compliant to the prescriptions that your cardiac rehab supervisors provide you with, because you might not fully understand the benefits of the exercise. You might not fully understand the benefits of the health behavior relative to what you want to accomplish. And ways to improve health literacy is by asking your physician questions, asking your dietitian questions, asking anybody within your care team questions about what do certain things mean? What does this medication mean? What does type 2 diabetes mean? That information will help you make more informed choices and help you understand why providers are encouraging you to take certain actions to improve health outcomes. Some of the benefits of health literacy, and I just showcased a few, but generally speaking, you just make better decisions when it comes to your healthcare plan on a more consistent basis. From a healthcare perspective, it increases patient safety. It reduces the prevalence of adverse effects. It improves health outcomes, which benefits you. And overall, you are leading a more healthy, active lifestyle. So managing your health, nobody said it was easy. With social media campaigns, with publications, people always have quick fixes for how to easily lose 30 pounds in 2 weeks. That's not reality. And I'm going to go into some Canadian statistics, in a little bit. But I just want to give you a brief overview of some of the core elements that are actually affecting your day-to-day choices when it comes to improving your health. So sex, biology is a big thing. Age. So as you age, it might become more challenging to incorporate healthy habits into your lifestyle. We often hear the excuse, I'm too old to change. That's not true. We're all capable of changing. It's whether or not you want to do it that will decide your future direction. Household income. So income is one of the bigger catalysts for predicting health. If you live in a more affluent area, you're generally more exposed to a broad range of healthcare services. There are more have more access to safer areas versus if you are living in a lower residential area. You might not feel as safe, walking 5 kilometers. Education as well, immigration status, geographic location, rural versus urban. We spoke about health literacy, predisposing factors such as social influence, So how you grew up, modeling of parental behaviors. As a parent, being in a position of influence as well for your children, if you have any, as well as motivation and confidence, which we'll delve into a little more in the next few slides. So when it comes to health and managing of one's health behaviors, what do Canadian women actually think? So in 2014, McDonald et al. Published or pursued a pan-Canadian environmental scan on women's perceptions of their health risk, as well as their perceived health needs and self-management practices. And what they've identified was that 80% of women, Canadian women, actually believe that they are largely responsible for their health. And the other 20% was women felt that physicians also played a role in their care plans, but they were largely responsible for decisions that were made. So we know that women believe that they're largely responsible for their health, but are women actually walking the talk? So looking again in our own backyard, although women believe that physical activity is very important for your health and to reduce your risk of developing cardiovascular disease, 80% are actually not doing what the physical activity guidelines suggest that you do. So that means 20% are achieving at least 150 minutes of moderate to vigorous physical activity on a weekly basis. And when it comes to eating fruits and vegetables, about 35% of women are actually consuming at least 5 servings of fruits and vegetables a day or more. So what this takeaway, or what this slide is telling us, is although we understand that we as women have responsibilities and are in charge of our health, it's not always easy to translate this evidence-based knowledge, these guidelines, into actual practice, because a lot of the elements that we've identified before, being a woman, makes it more challenging to be compliant with your exercise regime, makes it more difficult to eat healthy foods, because a lot of the social norms surrounding our biology. So the next slide, basically, I wanted to showcase the impacts of not engaging in exercise behavior. And this is information that is not necessarily always spoken about within our interfaces with medical professionals. So one, we are often told exercise is good for your health, but we don't necessarily know how those behaviors will translate in terms of health outcomes. So what I want to show you today, and again, this is just a lens of looking at inactivity in general and various chronic conditions that would be affected by inactivity. So by not being active, so by not consistently engaging in 150 minutes of moderate to vigorous physical activity, that increases your risk of type 2 diabetes as a woman by 39%. Coronary artery disease, 27%. Breast cancer, 15%. Hypertension, 23%. And what's really interesting with these findings is, as I was doing some research for this presentation, and looking at breast cancer. So oftentimes people after an event, they'll get motivated to change a behavior. For women who their mother or sister developed breast cancer, about 35% of them were able to change one or many behaviors to prevent their risk. 35%, which is still not that much. Ideally, we'd want it to be closer to 100% because we know the benefits of exercise relative to reducing your risk of developing breast cancer. So investing, modifying your lifestyle, making health a priority can lead to big returns. And when it comes to big returns, I'm talking about quality of life. I'm talking about enjoyment. I'm talking about independent living. I'm talking about positive social relationships, all the things that we want, increase in motivation, increase in confidence. There's so many added benefits to choosing health every day. So what this slide represents is that by engaging in regular exercise, so again, going back to 150 minutes of moderate to vigorous on a weekly basis, not smoking. If you're not drinking, don't start. Otherwise, for women, you want to drink maybe one a day at the very most, no more than, I believe it's 10 a week. And then 5 servings, so you have 5 happy fruits holding hands. You want to eat at least 5 of those a day. And that can ultimately reduce the risk of premature death by 80%. So just by engaging in these 4 health behaviors, you could prevent your chance of premature death by 80%. So strategies to help you change for good. So now we know what the landscape looks like with regards to self-management, how Canadian women are actually engaging in routine health practices. Now we've identified a need to identify strategies to help us change for good. So to consolidate some of the core findings of the literature, I've come up with some of the more 5 prominent behavioral strategies to help you transition from maybe an inactive state to a more active one, or a state where you're not consuming enough fruits and vegetables to a more to a state where you're consuming more on a daily basis. So first and foremost, so understanding the why. We'll talk about goals, self-monitoring, and how to manage lapses. So understanding the why. So this is, why is such a simple word, yet carries so much weight in terms of understanding the logic behind choosing to adopt certain behaviors versus others. So if there's something that I want you to take away from this session, if you're thinking about making a change, ask yourself, why is it important for me to make this change? And why is it important for me to make this change now? What is different between how I'm feeling today versus where I was a week ago? Or maybe I attempted to make these small changes a couple years ago. What has changed in your perceptions between then and now? And how can you leverage from those teachings to make this a successful experience? And then you can always create a decisional balance sheet. So the pros of going down this path versus the cons of going down the same path. That will shed some insight as to your perceived benefits and costs to making this transition. So why is it important for me to make this change? So a catalyst to engaging any behavior is motivation. Motivation, so we break it down into 2. So you have extrinsic, which is you have an external force that encourages you, that entices you to adopt the behavior. So you have reward systems. You have, it could be your physician telling you to engage in a behavior. So the motivation is not necessarily from within. It's an external force that dictates that this might be a good thing for you to pursue. Or there might be an incentive at the end of the rope, as you can see in the diagram. And intrinsic motivation is usually the preferred option. It's where you want to pursue an exercise. You want to eat fruits and vegetables because you really enjoy these. Those are options that generate a lot of internal satisfaction. And in the statistic, you can see that those who have intrinsic motivation are 6 times more effective than intrinsic motivation at sustaining health behaviors. And at the beginning of your health journey, you might want to do a combination of intrinsic, extrinsic, or fully extrinsic. And then hopefully that intrinsic will transition to intrinsic, where you can find enjoyment, where the exercise alone brings enough satisfaction that you want to continue pursuing it. Boost your goal IQ. So I'm sure you're all very familiar with SMART goals, but one big thing that I want to bring up here is the S. So the S is self-determined. So you want your goals to be generated by you. You understand your situation better than anyone else does. You are the driver of change when it comes to your health. Your goals have to be self-directed. We want you to commit to action. For women, a consistent theme is accountability to peers. So we want you, if this is something that works for you, identify people within your network who have played a supportive role, not just with regards to you engaging in health behaviors, but in different facets of your life. You need that accountability, or you might need that accountability to keep up with your goals. We're going to talk about monitoring, plan for setbacks as per usual, and single versus multiple behaviors. Oftentimes when it comes to behavior change, we get so excited about changing a number of our behaviors. If I could provide you with a piece of advice in alignment with the literature, we encourage you to start with one behavior. I want to walk 15 minutes a day. Let that be your one behavior. Don't change physical activity, nutrition, smoking. Identify one thing that you feel confident in your ability to address right now. Build that confidence over time. And then when you feel like that's become a routine, integrate another behavior. It just brings about more positive feelings into the experience, and you're more likely to continue on that trajectory of maintenance. And fun fact for you, 40% of those who actually achieve their goals have actually written it down and have set a goal. Some differences between men and women when it comes to goal setting habits. So women's goals are generally far more emotionally connected. That element allows women to be more successful in achieving their goals because of that intrinsic motivation element to it. Or because they've added an important element to them. So whether it's family, I want to improve my health for my family. And that is a little different than how men achieve or set goals. Women are generally more likely to stick to their goals when challenges arise. Women are more likely to set tougher goals, which might work for them or against them. So in healthcare, setting tougher goals, you would just have to be very strategic and setting shorter, more timely goals in between to inch your way closer to that endpoint. But in other spheres, such as professionally, setting tougher goals might not always be in your favor because you don't always have control over the elements around you. Which something that was quite interesting is that women are not as likely as men to visualize their goals. And this is something that, I think it's important for us to consider because there's a lot of added value to visualization in any sphere in your life. Visualizing yourself engaging in the behavior, identifying barriers that might prevent you from achieving your goals, and then try to translate that knowledge into practice. Self-monitoring. So I'll start off, because it's for the sake of time, I'm just going to go through this one a little more quickly. Self-monitoring is a critical element to behavior change. It's a critical element, or it's a supportive element to setting goals. So what self-monitoring does, so what it is to begin with, so it's you logging your behaviors, whether it's on a spreadsheet, whether it's on a tool that was provided to you by your healthcare provider. You have many apps that can record your behavior, wearable technology or syncable technology. It provides you with insight on your step count. You can input data with regards to your dietary plans. But what the purpose of this is one, it provides you immediate feedback as to what it is that you're doing. You can identify gaps in your behaviors. These gaps can then be translated into an opportunity to generate productive solutions to help you move forward towards your goals. It's also a great, for those of you who might be competitive, it's a great tool to use to develop a competition with yourself. It's also an opportunity to re-engineer your environment depending on some of these gaps that I've alluded to that might be causing issues to you engaging in a productive health behavior. So barrier management. So we're bouncing back. So you started engaging in exercise behavior, something comes up, you're not able to, you feel like because you haven't engaged in regular, let me rephrase that. So barriers happen all the time. 100% of us will face them. When you set a goal for yourself, you will face a setback of some sort. whether or not you let that setback interfere with your ability to continue moving forward with your health plans, that is up to you. So what we've identified between men and women when it comes to behaviors to lifestyle change, there is some differences. So again, we've used the same barriers for both sexes, for both genders. But what was interesting was that women with self-esteem. Women generally, their biggest barrier to engaging in healthy lifestyle practices is self-esteem. And this might be a reason why peer support groups are so instrumental in a lot of women initiatives. And then to overcome barriers, so this is just for your own strategic planning, but identifying the problem, brainstorm solution, weigh the pros and cons, build an action plan, and try out your plan. And this is something that you have to do for yourself. These are the steps that you need to generate to identify opportunities for future engagement. Quick facts, so perseverance is key. So 8 to 30 attempts before people successfully quit smoking, so never give up. And relapse prevention, so what happens when the novelty wears off? So finding a combination between extrinsic, intrinsic motivation, understanding the why. Why did this happen to me? What can I do to overcome this? Do I want this? Do I want to achieve this goal? Do I want to achieve another goal? I know that right now is a difficult time with regards to, COVID and the sanctions enforced on us. But what is important for me? Do I still want to sustain my health? What can I do within my ability to move forward with my health plan? And again, looking at like past experiences, building off what you've accomplished in the past. I've been able to overcome these obstacles in the past. Maybe I can move forward with the same solution. And again, you're always trying to find opportunities to create positive emotions in your experience, because this is a lifelong commitment. So key takeaways, really what I want to drive home is that one size does not fit all. Behavior change is complex, but is very possible. Be flexible. Things don't always work out to plan. You need to be able to adapt and execute accordingly. And ultimately, you are responsible for your health and your healthcare needs. Don't forget that. At the end of the day, you need to be able to look at yourself in the mirror and say, I did the very best that I could today to make the healthy choice the easy one. So that is coming to an end. There is also an opportunity to participate in a community fundraising event. All proceeds go to Toronto Rehab cardiac team. Here are some details. If you need additional information, Lisa could definitely help you out with that. Thank you very much, everyone, for your time. Now it is time for Q&As. So if you have any questions, feel free to pipe up, or I guess write them out, and I'll address them accordingly.
Wonderful. Thank you so much, Jessica. That was great. So yeah, if anybody has questions, please use the Q&A function on your screen there. We do have one already, Jess.
Yes. So the first question is one that I would often receive during my practice. So what would you recommend if someone doesn't want to change their health habits? And that is something that you need to be okay with. So for me, the take that I'll often tell people is, ask yourself, why is it that you don't want to change your health habits? What consequences do you foresee, or what benefits do you foresee in not changing a health habit? If you are okay with the consequences of inertia, if you're okay with the possibility of, increasing your risk to various different health conditions, unfortunately, that is a reality. But I think for me, the one thing that I would often tell my patients is, like, take a step back and just ask yourself, why is it that being healthy is something that you do not want for yourself? I would start with that. Because if I tell you, you need to change a health behavior, your immediate response is, that's not happening. I don't want to do that. And you just reaffirm your positioning as to why changing a health behavior is something that is not for you. Changing a health behavior could be for everybody. You just need to figure out for yourself, why is it that you do not want to do this, the consequences to it. And if you can, maybe even have conversations with some of your closer confidants and, maybe talk about the possible benefits without compromising too much of your life. Because I know for a lot of individuals, they feel like they might be giving up too much for a small change. And that doesn't have to be the case. It's reframing what being healthy actually means as well. Being healthy can add years to your life. It doesn't necessarily have to be a negative, but that's something that you need to figure out for yourself. Thank you for the question. It was a great one.
So we do have another one here. How do we measure positive change? How do we know our efforts are actually working, that we're actually being productive in what we're trying to do here?
Yeah, so that's great. And that's where the self-monitoring tool comes into play. So one, you need to determine for yourself, what does a positive change mean? What does a positive change look like? So if my end goal is to walk 150 minutes a week by the end of the first month, my next task is to sort of break down that big goal into smaller goals. And for me, a positive change might be to exercise, to walk 15 minutes a day, every day for the first week. I frame that as a positive change. And that is something that only you can define. Goal setting, self-monitoring, health behavior change, that is something that is self-directed. You set the evaluation parameters based on what you think is right, what you think is positive, because you are building off years of knowledge and trying to be healthy, of managing your relapses. So you are coming into framing this experience in a way that works for you, in a way that makes sense to you. So to answer that question, Lise, how do you measure positive changes? So one, be clear with your goals, self-monitor, and actually spell out, this is what a positive change looks like on a weekly basis, on a daily basis.
Okay, there's one here about sleep habits, Jess. So I can't change my sleep habits. There's always something important to do or something to read rather than going to bed and sleep. How can I change this?
So did I send you that question, Lisa? So
I'm sure
I think
a lot of us are feeling that right now. So yeah.
And then you layer a pandemic on top of that. So that's a brilliant question. Sleep habits is something that is very complex and of course unique to yourself. Some of the literature suggests that reducing screen time before bed, not having any electronics in your room, meditation apps are also very good, getting into a state of meditation. But again, all of that is behavior change as well, because you're integrating a new behavior into your current lifestyle practices. I would also ask myself, what is the stress coming from? So elevate, so be reflective with your behaviors. Understand why you're feeling the way that you are. Going back to the why am I feeling this way? Why is it hard for me to go to sleep at night? We have a phenomenal psychologist who's also a sleep specialist at the center, who could definitely help you identify some of the triggers in your environment that you can then use and re-engineer your space accordingly. So if you're able to maybe send Lisa an email or a quick note with your contact details, and if you're interested in having this conversation with our psychologist, again, who's a sleep expert, he could definitely provide you with more information.
That or your cardiac rehab supervisors.
Exactly.
Contact them and let them know for sure. just to reiterate, what is the role of my healthcare team in my behavior change? So you did say 99% of it is, you know, me, but what is the role of my healthcare team? How can I use them to help me with my behavior change?
Yeah, that's a brilliant question, Lise. So a common misconception that we often face in healthcare is a lot of people will come forward and say, listen, um, it's my physician's fault. I didn't know. Um, we have to take a step back and recognize that, and I'm not saying that all physicians are right, but we also have an ownership in determining how our interchanges, our interfaces happen with our healthcare providers. You know, a lot of literature would support, you know, coming up with your own questions before. So understanding what the scope of your meeting with your physician is, coming up with your own questions for them. You can't just expect them to understand what it is that you want, and understanding the parameters of physician time being so short and so critical. Come to sessions advance, figure out, and it all comes back to self-reflection. You know, understanding what you have control over. And if you don't understand necessarily what that scope of self-management means, have that conversation with your doctor. You know, tell them, I'm not being compliant with my medication. I don't necessarily understand what the gap is. Be the voice of reason. Be part of the problem-solving process, as opposed to waiting for your physician to generate those solutions for you. Because time just flies by. And unfortunately, for some of us, that's a luxury that we don't always have. So be proactive. You know, if you find that you're not aligning your behaviors with some of the guidelines, have that conversation with your doctor. Don't wait for them to talk to you about physical activity, because less than 20% of physicians talk about physical activity with their patients. You know, less than 20% of physicians talk to their patients about nutrition. So waiting for them to have that conversation with you, you're probably going to be waiting a very long time before that even happens. So bring forth information that you want to have a conversation about, is the advice that I would give.
Perfect. And I'm actually just going to quickly share one slide with you about next week's session. So please join us next week for a session with Dr. Ashley Heitema, where she'll be talking about quit playing games with my heart, sex differences, and cardiovascular disease. And so we hope that you're able to join us next week for this very exciting talk with Dr. Ashley Heitema. So thank you, everybody, for joining in today. And enjoy the beautiful weather outside. Have a great day. Thank you. Bye-bye.